Hello, friends. A very good day to you all. Welcome to Sovereign Telemedicine YouTube channel. I'm your host, Dr. Akebemidu Irene Emmanuel. And yeah, you're welcome. It's been a while. How many of you missed me? Okay. So today we'll be talking about the nightmare of every woman. Yeah, so I have some cases I would like to share with you. The first is a lady who presented to the clinic with a history of abdominal pain and bleeding per vagina and body weakness, extreme body weakness, and she also gave a history of missing her period. So when you did a pregnancy test, she have done a pregnancy test and it's showing positive. She went further to do a scan. The scan came out. She did a scan. I don't know where she did it. They said she was not pregnant. There's nothing in the womb. The uterus is of normal architecture and everything is normal, but she's bleeding. She's pregnant. Pregnancy test is positive and she's becoming weak. What happened? She had a ruptured ectopic pregnancy. Okay, now we quickly did a pregnancy test in our facility, found out that it was positive, an abdominal scan, and you could see it right there, ruptured, a sac-like baby and fetus in one side, but not within the lining of the uterus. So that's obvious ectopic pregnancy. So the blood picture at presentation, the blood volume was very low, so we had to optimize and voila, rush to the theater because you need to stop that bleeding that is ongoing inside. Okay, so second scenario was lady, same thing, was feeling dizzy, vomiting, and also missed her period. Of course, the lady, she was a young girl, scared to even discuss it with anybody and just holding it to herself. And this person is sexually active. And what happened next? She fell down sudden fall, and was unconscious. She was rushed into the hospital, and the only history they could provide it, she fell down suddenly and was unconscious, but is still breathing and everything. And when you are doing your examination findings, see that she is very pale. She was pale. You're doing your pelvic exam, see stains of blood, in her pelvic area, and quickly do a pregnancy test. You surprise, she's pregnant. So what you want to do at that time is to know what the PCV is, optimize the patient, rush the patient to the theater for an urgent exploratory laparotomy to stop the bleeder. Now that is the problem, because she is bleeding internally without her knowing, and she could bleed out more than half of her blood volume to be within the abdomen, and she's just dying. She is between life and death. So that's why it's a nightmare. Some persons, they don't survive it. Depending on where they go, they don't survive it, because most times they come in, it's already too late. They are already before you go rush the person to the theater, might even die. So it's a terrible thing that you need to take into consideration when you meet it. So what is an ectopic pregnancy, and what are the risks involved? First thing you must know is when the pregnancy that ought to be within the uterine lining, within the uterus, the womb of a woman, is no longer there, is ectopic. Any abnormal site other than the uterus is ectopic. And it can the most common site is the ampulla of the fallopian tubes, the tubes where the egg passes from the ovaries down to the uterus, to the womb. That part, the early part of it, is called the ampulla. That's where fertilization, where the egg and the sperm meet. Most ectopic occur within that place, and that place, the structure of it, and it can happen anywhere else, anyway, in the ovaries, the isthmus, even in the abdomen. It can just live where, just go and seed in the abdomen, any other parts that is not within the lining of the womb is ectopic. And the problem is only the womb is well has the architecture to house a child, because it can stretch, it can expand, but the fallopian tube cannot expand. So once it's trying to expand, what happens? It ruptures, and the next thing is bleeding. And if you don't go there immediately to sort out that bleeding, what happens next? The patient is, or the vital signs becomes unstable. The patient is near death. Do you understand? So serious attention must be put into this, because it accounts for many mortality amongst young ladies today. All right. So what are the major risk factors you consider? If one have had an ectopic pregnancy, you have to be careful, because you could have another one. All right. If you have had a fallopian tube surgery before, pelvic inflammatory disease. Yeah, I'm talking about pelvic inflammatory disease. All those many persons that come and be saying, I have infection, I have this, I have that, and they will not take proper treatment. They will not. The thing will be smelling too much. Be smelling too much. You will not take care of yourself. You will not take the right. You will not go to the hospital so that they will treat you properly, so that you will not be having a vaginal discharge that is smelly and itchy and what have you. You will not do that. You will leave it. You'll be taking drugs anyhow, going to different patent pharmacy stores and be getting drugs. You understand? And your condition keeps on being worse. Those infections can track up through the uterus, through the fallopian tubes, to the ovaries. And once it's like an inflammatory process ongoing. Once they become inflamed, when they heal and you don't take the right treatment for it to be treated properly, if it heals and heals on its own, it heals with scarification. And when that happens, there's blockage within the tubes and all that. If a pregnancy occurs, you might not be able to track down to the uterus, and ectopic pregnancy cannot be avoided. You understand? So what do? You ensure that you are properly treated. Take the right medications. It's not just infection. The infection we talk about, it's not just minor, it's a serious condition. So take care of yourself. Sexually transmitted infections, very rampant. Please take good care. Use all kinds of whatever you want to use, contraceptives, prevent having sexually transmitted infections. Please do. Okay, endometriosis, are also other risk factors that can cause, ectopic pregnancy. So, what I really want to hammer on is the pelvic inflammatory disease. Please, if you know that you are having those symptoms, vaginal itching, vaginal discharge, low abdominal pain, please go and seek help in the hospital so that you are properly treated. It is not a normal thing. If you know that you have missed your period and you've doing series of scans and it's not showing anything, you have done series of tests and it's showing pregnancy test positive, and you have missed your period, you are becoming weak, please go to the hospital. It might just be an ectopic. because if it ruptures, it will be a life and death matter. Yes, I've seen people who have rushed, they will do an abdominal tap and fresh blood just coming out from the abdomen. You understand? Take them to the theater. It's a major surgery, and you wouldn't want to be in that condition. One of the morbidity that results is that for they to be able to secure hemostasis and prevent bleeding from occurring, part of your tube and the ovaries will be ligated, will be cut off in the process of the surgery, because all that bleeder, all those places have already been affected, so they are removed. So if you lose one of your tube and the ovary, you know that there's only one that you have remaining for you to be able to reproduce with. Understand? For those that have reproductive career. So mind you, this is not only for unmarried women, also for married women too. Some women have ectopic pregnancy, you understand? And then for persons that have engaged in several in termination of pregnancies, you understand, and they did not do it in the proper place where they gain treatment and proper treatment. When the repercussion of your actions start happening, it will start with ectopic pregnancy, because all those scar tissue in the process of the termination of pregnancy, the curettage and everything, all those scar tissues can prevent pregnancy from happening. And if ever it happens, it might just be an ectopic. So you have to be careful. All right. And this, my dear, is a nightmare, because when that sets in, it's a life and death matter. Yeah. I want to take this opportunity to thank most especially a senior consultant on the platform, Dr. Mrs. Hilda Omorobe, for accepting to as an obstetric and gynecologist specialist to partner with us. Yes, we are happy to have you in the fold. Thank you very much for accepting us. And I would also like to tell you that Sovereign Telemedicine is 24 hours online platform where you can ask questions, you can seek advice, you can get consultations, and proper prescriptions will be sent to you, and proper laboratory providing. Yes, thanks for staying tuned. Please don't forget to click on the subscribe button, notification bell, and I will see you next time. Cheers. Have a lovely evening. Bye for now.